Hi, everybody. So, the article that I'm looking at is called "The Timing of Prenatal Exposure to Maternal Cortisol and Psychosocial Stress is Associated with Human Infant Cognitive Development." So, to go back to my original research problem that I wanted to ask is, can epigenetics be the link to understand that systematic oppression and individual abuse are negatively affecting newborns? And so this study that I'm looking at its goal was two parts: whether maternal cortisol and psychological stress during pregnancy were associated with cognitive and motor development in the offspring, and whether there was a sensitive period for this effect on development. And so we do know that cortisol is a steroid hormone that plays a critical role in the development of the body's major stress responsive system. And so cortisol actually increases 2 to 4-fold over the course of a normal gestation. And so this study is actually looking at that. It's looking at how does it affect the infant when there's an increase in maternal cortisol. And so the sampling method and the criteria were women with singleton pregnancies less than 16 weeks gestational age, and they were recruited from a clinic in Southern California and then followed from early pregnancy to 12 months postpartum. These women were English-speaking non-smokers over the age of 18. They did not take steroid medications, and there was no evidence of drug or alcohol use during the pregnancy. The sample size included the first 125 full-term infants, which was 60 girls and 65 boys, and their mothers, which completed the 12-month assessment. So the study design was an ongoing longitudinal study, and there were different parts that were being evaluated. So the first was, one of the components was 3 postnatal assessments, which was assessing maternal stress. And then there was also a medical history and obstetric risk that was obtained from a medical interview conducted by a research nurse. There were also maternal saliva samples that were collected for cortisol analysis, and maternal psychological assessments that happened 5 times during pregnancy. Also, during those times, maternal depression was assessed at the first 4 visits. And then lastly, there was the infant mental and psychomotor development, which was evaluated at 3, 6, and 12 months of age. So, the findings. The findings of this study are pretty consistent with the role of cortisol and the role that it plays in the maturation of a human fetus. So, early in pregnancy, the fetus is protected from increases of cortisol by these enzymes that actually convert cortisol into an inactive form. However, because it's only a partial barrier, when there's an excessive amounts early in gestation, so early in pregnancy, this will result in overexposure of the fetus with potentially detrimental consequences. But in contrast, when the pregnancy is getting towards the end, elevated cortisol is necessary and beneficial for maturation of fetal organ systems, including fetal lungs. The study is among the first to evaluate the effects of endocrine and psychosocial indicators of prenatal maternal stress for infant development. And it also provides new evidence that when exposed to maternal cortisol, it does have effects on the fetus with persisting consequences for infant behavior. Now, I would have loved to see this research. They are only evaluating the children to 1 year old, and so I would love to see them go past that and to see a longer time frame to be able to make some better conclusions. And also, this study included a low-risk sample of women with healthy full-term pregnancies, and so I would have loved to see them maybe evaluate women with more severe stresses and different backgrounds and different situations, and see if that would change the outcomes. And so, even further thoughts as I'm looking at this study, to go back to answering my original research question, I think I really need to look into studies of whether or not cortisol can actually act as that kind of shared pathway of genes. thus then answering my question and linking epigenetic studies and passing transgenerational trauma from mama to baby. And so I want to look further into that, cortisol and placenta, and see what I can find. These are my references, and thank you for listening.